Do you love reptiles? If you do, this is the video for you. Today we're doing a compilation of just a few of our reptile videos, true real-life cases of clinical presentations that we've seen at the hospital. And we have hundreds of videos, so we started with just a handful. If you enjoy them, please leave a like in the comments and we'll try to do more. Hi, I'm Dr. Pat with Little Critters Veterinary Hospital, and here we try to display real-world cases, what their significance is to owners and pets, and what the causes are. And we have Helix with us today. He's a 4-year-old bearded dragon. He's under anesthesia right now, and we're doing the initial prep to clean him up. He has clogged femoral pores, so we're just going to show you that really quick, and then we'll show you afterwards. If we look here, these are natural femoral pores on the male bearded dragons that form secretions. And a lot of these beardies, as they start to get older, these pores get impacted and don't drain. And if you look, you can see the secretions on the top, but what you should also see is there's a buildup of secretions under the skin here. When you feel them, it's very hard nodules under the skin. You can see this whole area is one big buildup of secretions. And they get really uncomfortable with this. They can get infected. We just briefly anesthetize them with gas anesthesia, and then we go in and clean these out. We're doing a surface cleaning on him before we even get to that point. He is getting gas anesthesia. He has a Doppler ultrasonic probe. That's his heartbeat we hear in the background. And so we'll show you the after once we get this done. So we're under anesthesia. The site has been surgically prepped and cleaned, and we have sterile drape and instrumentation. And we're just using hemostats and digital pressure to try to loosen up the secretions that are blocking the femoral pores. And as you can see, we remove pretty large plugs in these pores. But the important thing here is there's often more below these. So using kind of digital palpation to feel what's under there, and making sure after we've removed all of the obvious or frank plugs to go back in and clean and flush out each one of these is very important. And so we're just progressively going along. These plugs they feel like almost a hard wax, and so we're just trying to mold them or form them so we can get them out as intact as possible, so there's less debris left behind that we'll need to flush out. And this is a very rewarding and satisfying experience getting these out. The beardies can be uncomfortable with these, they can get infected, they can get really itchy, and so they do beautifully once we get this completed. And today we have the beautiful Rigby with us. He's an 11-month-old bearded dragon, and we're just highlighting him because he is a little bit different color morph and skin mutation. So he's what they call a leatherback. And so instead of the typical scales, he has more skin, or the appearance of skin. And it actually feels very different than the typical beardies, which have the very thick raised scales. You can see more of the scaling on the arms. He is a true leatherback. And he's also a cherry chocolate color mutation, which is why he's such a beautiful beardie, although I think you'd be beautiful without that mutation. Leatherbacks, really interesting beardies. They're actually gorgeous animals. They're not prickly to the touch, so a lot of people really like that. You can see he does still have some prickles around his beard here, but not as much as the typical bearded dragons do. The skin is more delicate because it is skin and not scales, and so they can get skin injuries, they can get tears. With other beardies, particularly mating, we'll often see injury to them. So skin is much more important as far as just good hygiene, making sure there's nothing abrasive in their enclosure, paying attention to small nicks and lesions, and treating anything we see early. That's Rigby, very handsome. This video is used to show the signs and symptoms of a bearded dragon in respiratory distress. This dragon presented with a long history of gasping when breathing, and also has metabolic bone disease, as we'll show later in the video. Respiratory distress can be from a large variety of causes in bearded dragons that can include pneumonia from bacterial infections, fungal infections, parasitic infections, metabolic bone disease causing skeletal collapse, gout if very severe, cancer, heart disease, and many others. Treatment includes oxygen therapy and aggressive supportive care in correcting the underlying problem. The prognosis is very grave when this is seen. And today we're doing a dental cleaning on a bearded dragon lizard. Here we're showing the placement of an IV catheter in the ventral tail vein. The tricky part here is stabilizing the catheter as it does protrude out at a slight angle, but our experienced veterinary nurses are able to handle this proficiently. He has been given IV propofol through this catheter and gas anesthesia. He is being monitored with a Doppler ultrasonic probe as well as a Cardell, which is being shown here. We do place them on a warming blanket and put their head in a downward drainage position. An endotracheal tube is being put into his airway to protect the airway from the fluids that are liberated at the dental. And we just stabilize that with a mouth gag across the tube and tape this to his head to stabilize the apparatus. It makes it a little bit harder to work around, but we feel like it's a very safe method for protecting the tube and his airway during the procedure. It's all hands on deck during a lizard dental cleaning. As you can see, we actually physically hold and stabilize the tube throughout the entire procedure, and then hand scale and remove all of the periodontal, the tartar, and the pus causing the periodontal disease. And here you can see, because of the acrodont teeth of bearded dragons, these teeth are set directly in bone, and the periodontal disease extends up to the overlying or underlying bone, where we have purulent debris or pus that has to be hand scaled and physically removed. An ultrasonic scaling alone will not remove this debris, although after hand scaling we do follow up with the ultrasonic scaling as well. Here we're showing you mandibular arcade as they hand scale and clean that, and this has already been partially cleaned at this point in the video. He is under general anesthesia still, and again his head is at somewhat of a dependent drainage angle. In spite of the fact that he has a breathing tube in, we still try to make sure that all the fluids are running to the outside of the mouth, just to ensure additional safety. One nurse does nothing but monitor their vitals throughout this anesthetic procedure, and another nurse does nothing but monitor anesthetic depth and tube placement. Generally, we have 3 nurses and a doctor working on these animals during their procedure. And here you can see that the arcade is cleaning up beautifully. Instead of the thick yellow pus, we now have clean bone and teeth. And we're here today with Travis, a 7-year-old bearded dragon. At 7, he is a senior citizen, and he is in his second home. Had some nutritional issues and some care issues in the first home. His new mom is getting him checked out because she noticed some abnormalities and has him on a good diet and excellent care. And as you can see, Travis is an absolute sweetheart. There's a few things we noticed. One is he is obese, so you can see he has a very robust body condition, and that's obviously from his previous diet. And then he also has some lesions. So the owner noticed that his femoral pores looked plugged or blocked, and they're enlarged. But if you notice, we have a big large scab here, another wound here. These are extending from the femoral pores. We have swelling in all these pores. We do have impacted femoral pores, and they have abscessed more than likely. You can get tumors in bearded dragons too, but this looks like an abscess. We're going to clean all of these out and do some wound care and make sure nothing else is going on under there. He also at some point either had a tail injury or metabolic bone disease, so you can see the tail takes a little right angle turn here and at the tip, and this whole area of the tail is rigid. These vertebrae actually don't bend, so osteomyelitis or an infection previously can result in that as well. The rest of the tail bends and is pretty normal. And we have a lesion under the throat. He's got a lump, and this is a little hard to show on video, but it's right here. And this is a firm, mobile lump that you can actually move back and forth in the skin. Not painful, and it does move all around kind of the ventral neck here. They can get fat bodies in here, but the worry is this is where the thyroid lives. And beardies, as they become seniors, do get cancer, and so the concern would be potentially that we have a thyroid lesion as well. The immediate plan for him is to get the femoral pores in the wound taken care of today, and then we're getting some blood on him to see what's going on metabolically. It tells us a lot about what their insides are doing, so all the organ function, red and white blood cells, and then a needle aspirate of this to see what kind of cells are in there and if it's something we need to be concerned about. That's Travis. And today we're showing you Agatha and telling you her story. She started life as a child's pet. What is she doing now? Agatha started life as a child's pet. She was loved, but eventually life changed. The child grew up. Yes, we can talk more about that in another video. But the family realized they could no longer provide what she needed. They made a hard decision. They decided to let her go to a better home. Rehoming isn't failure. Sometimes it's responsibility. Rehomed doesn't mean unwanted. It doesn't mean broken, and it doesn't mean the story is over. Sometimes it's exactly where the healing begins. Her new owner wasn't looking to replace a pet. She had tragically just lost her own bearded dragon, a companion she bonded deeply with. Anyone who has ever had a bearded dragon or loved a reptile understands this. They're not just lizards. They're routines, they're quiet company, they're a presence, they're big characters, and lots of fun and love. So this wasn't about filling a space. It was about allowing something new to grow alongside that loss. And sometimes the animal that needs a second chance, well, they just meet the person who needs one too. And that's what Agatha did. In veterinary medicine, we see rehoming stories every day. The ones that succeed all have one thing in common. Someone chose compassion over guilt. This bearded dragon didn't lose a family. She gained a whole new chapter in her life. For Agatha, she's found a wonderful new home with a loving owner who will give her all the needs for the rest of her life. Sometimes rehoming is the best thing you can do for a pet, and it's important to realize that you're no longer providing the care, the time, the attention, or the love the animal deserves to have, and then make a responsible decision to find a home that will provide that. That's what Agatha has now. He also at some point either had a tail injury or metabolic bone disease, so you can see the tail takes a little right angle turn here and at the tip, and this whole area of the tail is rigid. These vertebrae actually don't bend, so osteomyelitis or an infection previously can result in that as well. The rest of the tail bends and is pretty normal. This bearded dragon is under general anesthesia, so we can properly treat advanced femoral pore disease, not just what's visible on the surface, but what has been building quietly beneath the skin. Femoral pores are normal anatomical structures along the underside of the thighs. They produce a waxy, keratin-based secretion used for scent marking. That secretion is expected. It's not a failure of hygiene, and it's not something owners cause by not cleaning enough. The disease process starts when that secretion fails to clear the pore normally. Over time, the material thickens, it dries, it compresses, and instead of exiting the pore, it begins to compact deeper and deeper below the skin line. What makes this condition so deceptive is that the external appearance often looks far less severe than what's happening underneath. A pore may appear mildly enlarged, darkened, or crusted at the surface. Underneath, there can be a much larger column of hardened material extending into the pore tract. That deeper material stretches the pore opening, irritates surrounding tissue, and creates a trapped environment where bacteria can thrive. This doesn't happen quickly. This is a slow, progressive process that develops over months. As the impaction advances, pressure builds beneath the skin. The tissue becomes chronically inflamed. The pore opening loses its normal elasticity. Drainage becomes impaired. In some cases, infection develops beneath what still looks like just a clogged pore. One of the reasons femoral pore disease is so commonly underestimated is that many bearded dragons continue to act normal. They eat, they bask, they interact. Reptiles are extremely good at masking discomfort, especially when pain develops gradually. By the time changes are obvious to the eye, the disease process is often already well established. That's why this procedure is being done under anesthesia. When impaction reaches this level, removing only what's visible on the surface is not adequate treatment. The goal is complete removal of all compacted material, including debris that extends beneath the skin and cannot be safely accessed in an awake animal. Under anesthesia, we can work slowly and methodically. We can clear each pore fully, reassess depth, and ensure no residual material is left behind. This matters because any debris left under the skin continues to drive inflammation and makes recurrence much more likely. As the plugs are removed, we're not just extracting material, we're continuously evaluating tissue health. We're looking at the integrity of the pore opening. We're assessing whether the surrounding skin is inflamed, fragile, bleeding, or discolored. We're watching for discharge or odor that could suggest bacterial involvement. These details guide what happens next. Pain management is a critical part of this process. Chronically impacted femoral pores are painful. The tissue has been under pressure and irritation for a long time, even if that pain wasn't obvious outwardly. Manipulating inflamed pores without anesthesia and analgesia causes unnecessary stress and discomfort. In many cases, patients require pain control and anti-inflammatory support after the procedure. Some cases also require antibiotics, depending on what the tissue looks like once the pores are fully cleared. This isn't something that can be decided from the surface alone. It requires seeing what's actually happening beneath the skin. This is not cosmetic care. This is medical treatment. And this is also why this level of impaction should not be managed at home. Squeezing, scraping, or probing femoral pores without proper assessment can tear tissue, force bacteria deeper into the pore tract, permanently damage the pore opening, and convert a treatable condition into a chronic one. Once impaction extends beneath the skin, home care is no longer appropriate or safe. Prevention is where owners can make the biggest difference, but prevention is often misunderstood. Prevention is not about abrasion. It's not about trying to mechanically wear pores down, and it's not about scrubbing or squeezing pores to keep them clear. What actually matters is supporting normal skin health and gland function while minimizing contamination of the femoral region. That starts with husbandry fundamentals. Loose or particulate substrates that can pack into pores or retain bacteria increase risk and should be avoided in many cases. Solid, cleanable substrates reduce contamination of the femoral region and make it easier to maintain a dry, sanitary environment. Movement matters. Dragons that are sedentary, because of small enclosures, limited enrichment, or chronic illness, are more likely to develop problems with gland clearance. Enclosures should allow walking, climbing, repositioning, and regular changes in posture throughout the day. Temperature and UVB are foundational. Improper basking temperatures and inadequate UVB impair skin health, normal shedding cycles, and overall physiologic function. When those systems are off, gland secretions are more likely to become thick and abnormal. Hydration and nutrition also play a role. Chronically dehydrated dragons tend to produce thicker, drier secretions that are more prone to compaction. Consistent hydration and appropriate diet support healthier skin and gland output. Hormones are another factor, particularly in mature males and during breeding seasons, when femoral pores can become more prominent and active. During these periods, monitoring becomes especially important. At home, early warning signs include pores that are enlarged, darkened, cracked, crusted, or surrounded by redness or swelling, as well as subtle changes in posture, movement, or tolerance of handling. These signs often appear after discomfort has already been present for some time, which is why routine visual checks matter. If you only remember one thing, remember this. By the time femoral pore disease is visible on the surface, the real problem has usually been developing under the skin for a long time. That's why partial cleaning isn't enough, and why complete medical treatment matters. Once you understand that, you can't unsee it, and noticing it earlier is where outcomes truly change. As you can see, he is very lethargic. He is alive, but very weak. And he has an important story to tell. So we're sharing his story with you in the hopes that others can learn. This little Beardy is supposed to be a year old. And for those of you that know Beardies, he is very small. And earlier this fall, the owners noticed that he had stopped eating and become very lethargic and wasn't moving much. And so they called a couple pet shops, and the pet shops told them that he was brunating or pseudo-hibernation. And so they assumed, based on that conversation, that this was a natural response. And so he's spent 2 months not eating, not moving, not doing anything. And if you look at him, you can see he is emaciated. You can see the pelvic bones. There's no fat in between the pelvic bones. His little legs have lost all of their muscle, very weak. His eyes are sunken in, and he has retained shed and discharge by both of his eyes. This little guy is in very critical condition. And the important story here is, if you're controlling the light and the temperature for your bearded dragon, he really shouldn't be brunating. Yes, sometimes they slow down a little bit, but they should still be eating. They still should be responsive. So if you have a bearded dragon or a lizard and you're new to them and something's abnormal, please take them to a veterinarian. Don't call pet shops and ask for advice. While some of them are very good, you never know how much experience they have with that individual animal, so don't take the chance. So now, what are we going to do with this little one? The plan is to start him on calcium injections because he has almost certainly metabolic bone disease. He also needs to have his eyes flushed, so we'll be doing that to get his eyes open because he can't physically open them right now. And then we'll treat whatever we find once we get those eyes open. We're going to start him on syringe feeding. We've gone over all the husbandry, the thermal gradient, the lighting, which they did have heat and light controlled. As soon as we get him eating and ingestion moving through him, we'll be running a fecal, but we are presumptively starting him on medications for parasites. There's a lot of just supportive care effort to try to keep him alive long enough to get some answers and get him to heal. And we don't know if he's going to make it, but we do know that we're going to try for him because he's just a young little one and deserves a chance.
This little bearded dragon was starving. Even though she wanted to eat, every bite kept coming back up. What could possibly be stuck in the back of her throat? We'll show you. When we looked inside, we found swelling deep in the back of her throat. Sitting on top of it, vegetables were jammed in place. She had last eaten over 24 hours before. Can you imagine eating like this, feeling like this, for weeks? So under anesthesia, we carefully reached back with a hemostat and removed a large clump of vegetables. Choking in bearded dragons can happen for many reasons. Food stuck in the throat, infections or swelling, masses, cancer, aneurysms, even weak swallowing muscles. For her, removing the blockage did bring instant relief, but the swelling remains. The mystery isn't solved yet. Every struggle has a reason. The question is, will we find it in time? As a doctor, it's your job to find it. As an owner, it's your job to acknowledge the small changes, address them, don't ignore them. They're a sign.